Hey, thanks for joining us today on Untamed Television. I am your host, Craig Bielig, just like it says right here, right there-ish, wherever. And I'm joined today by Dr. Derek Walker, kind of new to our area as a general surgeon.
Yes.
Yeah.
Great to be here.
Practicing up in Brigham City, is that right?
Brigham City, yes, sir.
Right. So, Dr. Walker, was this a big move for you to come here? Are you from this area? Where'd you grow up?
Well, I grew up in Brigham City, so it was a natural transition to want to come back.
Yeah.
I've been all over with the Air Force. Went from Mountain Home Air Force Base up to Pullman, Washington after I got out of the Air Force.
Yeah.
Was there for 9 years working with a colleague in the Air Force, and this opportunity came up, and we couldn't pass it up. So,
of course,
got the chance to come back. So we're excited.
Of course. Well, it's great. It's great to have you in the area, and I know there's a big demand for general surgery, which brings me to probably our viewers' very first question. What is general surgery? I mean, you said you're in the Air Force, so is that only operating on generals, or how does that really work?
Good question. Nope, we don't discriminate. We'll operate on anybody. So,
okay, good.
But a general surgeon is a MD or a DO who has done 5 years of additional training as a resident, and we operate on anything from the neck down. Have some other subspecialties that will do their isolated body part, so to speak, but we take care of anything from thyroid, in a thyroid cancer, to breast cancers, doing breast biopsies. We do colonoscopies, upper endoscopies, hernia surgery, and gallbladder surgery. We get called for appendix a lot in the middle of the night. So, and we also take care of colon cancer.
Right.
So a wide variety, and so it makes it interesting. It's never dull.
Right. Quite a wide variety of skills you've got to have there. I mean, colonoscopy is a procedure.
Correct.
But if you have to do surgery for colon cancer, that's a surgery. So
it is, and it's nice that we were the ones doing the colonoscopy that then know where the polyp was that might have harbored the cancer, and we know how to take care of it. So one-stop shopping. Right.
And yes, viewer out there, if you are over 50, you need a colonoscopy. I don't care what you've been reading lately or any of those other things. It's a simple test. It's an easy test, and it saves lives.
I agree.
You've seen
100%.
that in action, probably.
100%. It's the best test we have of identifying a polyp, and there are precancerous polyps and getting them out and getting you better.
Right. Right. So do that. One thing you mentioned right before we came on the air, which was interesting to me, is that you do varicose vein surgery.
Yes. Yep.
And I, for what it's worth, I don't know that much about varicose veins.
Okay.
Here's the thing I know about them: they're ugly, and a lot of people want them taken off, but they're painful too.
Correct. Yeah. Not only is there the cosmetic portion of it, but mostly it's quality of life. Who does varicose veins? Well, general surgeons. We're trained to do them. Vascular surgeons, even some interventional cardiologists will do it. And there's actually even a subset of folks that just do veins. They've been trained, and that's all they want to do, and so they set up a shop and do that. So you want to go to someone who's been trained to do them. What are varicose veins? Well, varicose veins we all have veins. Veins return blood back to the heart, but we normally associate varicose veins in the legs. Right. And that's where we see them, right, when we get older.
That's all I thought they was just in the veins. Or in the legs, that's what I mean.
In the legs, right. But they're, you have two systems. You have a deep and a superficial system. Those are communicate via perforator veins. But the veins that we typically are concerned about with varicose veins involve the superficial system. And the only way to really determine the degree of disease is getting an ultrasound. And we're looking for what's called venous insufficiency, or blood that's going backwards. So veins have one-way unidirectional valves in them that prevent the blood from going backwards as it's returning back to the heart. But once they've become diseased, they fail, and subsequently other valves below will fail because of the increase in hydrostatic pressure, and then it causes the unsightly varicose veins that develop. The worms, so to speak.
Those ugly things.
Those ugly things.
Spider veins and
spider veins can be part of it, but we really want to see where the disease is, and so we can best address how to treat the varicose veins.
Okay, so as you're describing the treatment, the first thing is a diagnosis, of course, just like anything else, and you can get that diagnosis maybe from a family doctor, or do you really need to see a specialist to know if it's...
Yeah, you'd want to start with your family doctor. Is a great way to go. What are the symptoms? When should people be alarmed and want to seek some treatment? Well, the big thing is heaviness, achiness, fatigue, swelling, itching.
Right.
So all those things are kind of clues that maybe something's going on, but not all swelling in the leg is due to a varicose vein. There could be problems when your heart's not pumping effectively, right, from heart failure. And some other issues. So yes, it requires you go into your primary doctor. They might be able to do some other tests to make sure that they think it's varicose veins, and then they send them onward, and we can go ahead and take care of that. So
that's where you come in.
You bet.
So describe to me also what it is that you do once you've decided this is a varicose vein that can be treated. Where do you go from there?
Good question. So the initial step is, of course, the physical exam and the history. We're going to have initial consultation with the patient. The next part is getting the ultrasound, and we want to see where the disease is in the superficial venous system. You have two large, long, straight veins, and one is the greater saphenous vein, which starts down by your medial ankle, goes up to the medial groin crease, and then you also have the small saphenous vein, which is back of your leg, basically, and enters in behind the knee. And those are the two main veins. And if they have disease identified by a certain velocity of blood going backwards, which the ultrasound technician will be able to determine, that's the first step. And then we also want to see how dilated they are. And why is this important? Well, it boils down to insurance. Insurance wants to see, do you meet criteria? Otherwise, they consider it all cosmetic and they won't pay for it.
They want to see a need.
Correct.
They want to see a need that is affecting your health.
Correct.
Not that you don't look good in a pair of nylons.
Right. They don't care about that. They don't care about that. Right.
So surgery is the actual removal of the vein, or
well,
some people say stripping of the vein.
Well, right. That's a word that gets thrown around a lot because that was the old gold standard. But things have changed. About the last 15 years, it went away from the archaic method of where they used to access down by the ankle, make another incision by the groin, stick a semi-rigid catheter up there, put a little cap piece on it, and actually yank it out. Wow. From the ankle. And it worked well, but it was a pretty tender afterward. You get a lot of bruising.
I almost fainted. I mean, that sounded really scary there for a minute.
And it was took a little longer to recover from that. But now we've kind of progressed, as with all things in medicine, newer and better things evolve, and that's applied to varicose veins. So the newest technology involves radiofrequency ablation or laser ablation, where we actually use energy placed via a catheter in the vein while we're using an ultrasound to guide us in the correct position, and then we apply the heat to the lining of the vein where the collagen fibers are, causing those to contract down. So in a sense, we are leaving the vein in place but closing it off. Right. So gone is the stripping, gone is the longer recovery, and the results are great. So
that's great. So what is comfort and recovery realistically like for someone with this? What can they expect?
Well, really, we only give them a 48-hour window in which we want them to have restrictions of lifting, of strenuous activity. The day of the procedure is tolerated very well, and that we give them a pill to take as a slight sedative. You have someone to drive you. We use a local anesthetic solution, and it's all done office-based. But then afterward, your leg will be wrapped in a special wrap. You'll have your compression stockings on, and you'll have to do some elevation for the first 48 hours, after which you wear a compression stocking for the next 2 weeks, but you'll have no restrictions.
Really? What do your patients say, like 3 weeks down the line?
It still can be sore in certain spots, but overall, they're pleased. Again, it takes about a month to see what's going to happen with the ugly ones that were under the surface of the skin, because we're not directly treating those. We're treating the longer vein off of which these originate, and by treating that, the others will slowly go down. And if not, there are other things we can do as far as what's called sclerotherapy, which a lot of people have heard about, where you inject the chemical solution, or even small little segmental removal of veins that just don't go down.
So you have a sort of a palette of treatments that you can apply and get somebody the results that they want.
Correct.
Wow.
Yes, sir.
Wow, this is very interesting. Did you know this about veins, by the way? All you people out there watching, Dr. Derek Walker has lots more information available for you. All you need to do is give him a call at
Canyon Surgical Clinic.
Right.
And I hate to say I don't know the number right off
Well,
the
it's
top of my
okay.
head, but
You're
I
new in town.
apologize.
You're new in town. You can look it up. It's Kenyon Surgical Clinic, and we can put it on the screen for you
Right.
after for this also. But this is the guy you want, okay? If he hasn't convinced you to get your veins done, I don't know what we can do. In fact, I'm going to have him look at my leg right after this show.
Perfect.
I really am. You think I'm lying? I'm not. This is Untamed Television. I'm your host, Craig Bielig. We're joined today by Derek Walker. Dr. Derek Walker, general surgeon who can also help you with those nasty, ugly, achy, itchy varicose veins.
Be glad to see you.
Be glad to see you. Come on in and visit with him. Thank you for watching Untamed TV.